So Beth Jorgensen graduated from Hope College in Holland, Michigan with a bachelor's in psychology in 2006. She went on to graduate from UNC Charlotte in 2008 with a Master of Social Work. She currently works as a clinical social worker with Atrium Health Levine Children's CF program. Since starting as a CF social worker in 2015, she has started a family advisory board, implemented mental health screening, and helped organize many educational events. Elizabeth obtained her LCSW in May of 2018. During the summer of 2020, during the global pandemic, she, along with a CF psychologist, started a virtual support group for CF teens. In her free time, Elizabeth likes to travel, read, and spend time with her cat, dog, friends, and family. And she also enjoys cheering on the Carolina Panthers. So, without further ado, I'm going to hand the meeting over to Elizabeth.
Okay. So let me try and figure out how to share my slides. But I'm honored to be here with you this evening. I have a real passion for CF. I've been a CF social worker for almost 8 years. Okay, so to get started, I just wanted to kind of start the beginning. Many of you might be familiar with the TIDE study that was completed. It's kind of the basis of all the CF Foundation talks about with their protocols around mental health screening and support. So it was a study that was done across 9 countries, including the US and Europe. There were 6,000 patients with CF, 12 and up, and over 4,000 parents. And the results basically were that individuals with CF and parents of children with CF were found to have a prevalence of 2 to 3 times the average population of anxiety and or depression. Then I have a graph, but basically what it shows is that about 10% of adolescents and 19% of adults with CF have a prevalence of depression, and then 31% of fathers and 37% of mothers report depression. And then anxiety, kind of the same trend, where the least is the adolescents with 22%, and then 32% of adults, 36% of fathers reporting anxiety. And again, the number one is mothers having the most anxiety with 48%. So I'm sure a lot of you can probably relate to that. Sorry, did you not get it? Get the slides? So some of you may be wondering, why is it more prevalent in the CF community? And some of you may not wonder that at all, because it's very obvious to you. So some of the reasons that I have, and feel free to include anything in the chat as to why you think so, or why you've experienced it. But some of the reasons being illness uncertainty, medical trauma, pill swallowing, stress, just the time management of getting everything completed, trying to do school or work, and manage treatments and go to the doctor and get your labs and everything like that. Balancing it all can be a lot. Also balancing school and work and the problems with having to be absent or not be able to perform to the level that you typically do. Self-esteem issues or bullying, pain, the burden of care, new colonizations leading to hospitalizations, a fear of poor performance on PFTs or being weighed. I'm sure a lot of you can relate to that there's a lot of anxiety that if you don't do well, you might be hospitalized or something bad is going to happen. There we go. So any additional ones that anybody has, feel free to enter it into the chat. It's like I said, it's not, you guys are also the expert on your own experience. But why this is so important is the impact that it has on our health outcomes. So those who are experiencing anxiety and depression have an increase of hospitalizations. They have higher healthcare costs and are more likely to engage in risky behaviors like smoking and drinking, which is very detrimental in CF because we know your lungs are already vulnerable and a lot of people already have liver issues too, or if they don't, then with Trikafta, you're concerned about that too. So that's the last thing that you want. people to be engaging in. And then also whether the patient is experiencing anxiety and depression or the parent, it's proven that there is a decrease in adherence to the medical regimen. So it makes sense if you're depressed or feeling down, you don't have the energy, you don't feel like doing your treatments, you don't feel like taking your medications. And as a parent, maybe you don't feel like, setting your child up to do their treatments or forcing them to do it when they're fighting you about doing it. So, it makes sense that that would be a side effect. So also tend to have worse lung function, have a lower BMI, poor appointment attendance. If it's a real source of anxiety for the parent and or patient, then of course they're going to avoid going to clinic because that's, a real source of their anxiety. I'm on slide 7, if that helps. Yeah. Decrease in their quality of life and poor family functioning are all the negative side effects of having untreated anxiety and or depression. So what are some of the symptoms of anxiety? This is what symptoms that are for parents as well as patients. And I always tell my patients that it's normal to have a certain level of anxiety or fears or worry, but when it starts to really impact your quality of life is where we want to intervene. So like leading up to this presentation, I'm anxious. Giving this presentation, I have anxiety, but when it concludes, that anxiety will go away. But when we're worried about it is when it's affecting your ability to sleep. So you're not able to go to sleep at night because you're up worrying about things, or you can't concentrate at school or work because you're worrying about things, or you're avoiding doing things with friends or going places because of your anxiety. So at those points when it's really affecting you being successful or having a good quality of life is when we want to be able to intervene and do something. And something important to realize too is that we're not just worried about anxiety and depression related directly to CF, it's all facets of your life. So maybe your child has no anxiety about their CF or going to clinic. That could be strictly about school or friends, work, any of those things. So it doesn't have to just be specific to CF. So through the CF Foundation, they have standards that we screen for anxiety and depression at least once a year for every patient ages 12 and up. So if you haven't already, hopefully you have, but this is what the GAD-7 tool looks like and the questions that we ask. This is a validated tool that we use for ages 12 and up, and helps us to decipher how someone is functioning and what level of anxiety they might be experiencing. Some symptoms of depression, depressed mood, lack of pleasure, appetite change, sleep change, fatigue, poor concentration, thoughts of death or self-harm. I think it's important to tease out some of the side effects of just having CF or having an exacerbation and what's true depression, because I'll have kids that, they're reporting that they're not sleeping well and they're feeling fatigued and they're not very hungry. And maybe it's all related to an exacerbation that they're having rather than true depression. So unfortunately, there's not a tool specifically to use within the CF population. So this is the best that we have. So that's what we go off of. But I think it is important to take all of that into account. And this is the PHQ-9, which is the tool that we use to screen regularly for ages 12 and up. Obviously, the scariest question on there being question 9. And that's the one of thoughts you'd be better off dead or of hurting yourself in some way. So we always pay close attention to that and make sure to intervene if someone does answer positively on that question. But this is what the tool looks like that we utilize for screening for depression. So depressive symptoms, what parents should look for. So if your child is withdrawing from their friends, they're spending a lot more time alone, they seem sad, hopeless, empty, statements about their CF, like I quit, I just want to give up, those sort of things. A decrease in their academic performance, change in their adherence to their medical regimen. So maybe before they were doing a great job with doing their best and taking their meds, and then you're noticing that they're not doing it, or they're pretending that they're doing, lying about it, or hiding and, cutting things short. Problem sleeping or excessive sleeping, frequent irritability or anger outbursts. I mean, certain times during their teens, this can be expected and normal, but really looking for what's out of the norm, and what is persisting. Self-harm behaviors, frequent thoughts of death and dying, statements such as, I wish I was never born, and an increase in risky behaviors. So this leads to, I wanted to touch on suicidal ideation. It's a scary topic. It's, no one's really comfortable talking about this. I know for parents, it can be scary because you don't know how to bring it up or how to address it, and also not really sure what to do if, what to respond to when your child says something about this. So I think it's important to realize that talking about suicide is not going to encourage anyone to partake in suicide, but rather it's more likely to reduce their chances of suicide. If your child says something to you, or there was a clinic that came up, a concern that came up at clinic when doing like the PHQ-9, it's important to secure your weapons. And this can also include just like household knives, pills. Even if they're the pills that are prescribed for your child, it's important to recognize the ones that could be of harm and keeping those locked up and making sure that you're the only one that has access to it. Taking any comments about suicide seriously. Sometimes people will say like, oh, they're just doing it for attention, or they don't really mean that, or they're just getting a reaction. And I just think it's always safest to take whatever they say seriously, and, make sure that you get them connected with the help that they need to tease out and make sure that they are, ensure their safety. Ensuring that they have someone to talk to. That person may not be you that they feel comfortable with, but it could be a relative, a friend, someone from church, or even a therapist that they're already established with, and just making sure that they do have someone to talk to. A lot of times my patients don't want me to tell their parents, and it's solely because they don't want their parents to worry. They don't want them to know what's really going on. And so it's not that they feel like they can't trust you. It's more so that they just don't want to concern you or alarm you. If they're not already in counseling, seeking counseling. If this is something new, bringing it up to your CF team, letting them know. If they already have a therapist, letting them know your concerns or what's going on. And then of course, always just being aware of your resources. So going to the emergency room, calling 911, or the 988 new suicide hotline, which you can call or text, utilizing your local mobile crisis or walk-in mental health. So what are some of the risk factors of why someone may be more likely to have anxiety or depression? So if you have a parent with depression, you are more likely to suffer from depression yourself. Any kind of family history of mental illness puts you at a higher risk. Having trauma history, having a chronic illness, and environmental factors as well will put you at a higher risk for experiencing depression. But on the upside, there are protective factors. So sleep and structure, physical activity, positive family time, these are all things that can help protect someone from suffering from depression or anxiety. Early identification of the problem. So that's why it's so important that we do these regular screenings in clinic to try and identify the problem and get the help that the person needs early on before it becomes a larger problem. Positive parental coping. So if you yourself are struggling with anxiety or depression, making sure you're getting the help you need and setting a positive example for your child. So whether that's therapy or medication or whatever that looks like for you, but making sure you take care of your own mental health so that's not affecting your child. And then shared management of CF. So like we've talked about, there's such a large burden of care that goes along with CF. So I'm all about enabling or engaging them in their own care and making sure that they know their medications and can do their treatments and all of that, but helping as much as you can also, like getting them set up or sterilizing their equipment to help reduce some of that burden, especially because everyone's schedule is so busy and they're more likely to be successful and have a more positive experience if they can get some help and support through that process. So hopefully everybody's aware that within your clinic, you have a mental health coordinator, and it looks different at every clinic. So for example, at my center, I myself, the social worker, share that role with our clinical psychologist. So my role is doing the mental health screening, providing education about what anxiety and depression are, doing some brief intervention, and then referring for counseling if necessary. And that might be to our CF psychologist, or it might be to another resource that works better for you in your community or online. So if you don't already know who your mental health coordinator is, I encourage you to talk to your team and find out, and so they can be a resource to you, whether you need it now or you might down the line in the future. And they're there to help support you as well as your child. So there is a standardized process that was passed down through the CF Foundation, just signifying that yes, we do annual screening. We also will do screening if there's any kind of concern, whether that comes from a parent or a patient reported. And I think it's important to recognize that the PHQ-9 and GAD-7 are not diagnostic tools. We're not diagnosing anyone in clinic with anxiety or depression. And how I kind of touched on it earlier too, about some of the stuff maybe better explained by their CF diagnosis. I've had kids that have scored off the charts with the GAD-7 or PHQ-9. And really it was more indicative of maybe they're experiencing ADHD symptoms. So they're having trouble concentrating, they're fidgety, they can't relax. It's not anxiety, it's more ADHD. Or, teenagers scoring high in the PHQ-9 because they're up late playing video games and they're not sleeping, and then they're tired and they're not doing things they used to like to do because they're tired, because they're not sleeping well. So maybe rather than addressing depression, it's more sleep hygiene and focusing on that. So, and then also, if there are concerns for children under the age of 12, there are other screening tools that we can utilize. It's just not yet a standardized practice that we screen under the age of 12. So I've heard there's a lot of questions and concerns about Trikafta. I'm definitely not an expert, but we have seen reports of an increase in depression, anxiety, and some other issues. Typically, what we've seen is that within a couple months, these symptoms do resolve, sometimes sooner than that. But in the meantime, while people are experiencing this, it is important for them to connect with a mental health professional to try and work through some of these things that they're experiencing. And some people ultimately may decide that it's unbearable and that it's not getting better and it's not something that they can handle or live with. So there are options and some research and studies that are being done right now about like working with your pulmonologist and pharmacist to be able to trial dosing changes that may still give you effectiveness from the drug in terms of your lung function and low sweat chloride, but also a decrease in some of these adverse symptoms that people are experiencing. It's something that is an ongoing, and there's going to be continued monitoring and trying to figure this out. It's not something that they've definitely figured out or know exactly all the correlations and the effects of it. So I think it's still kind of a pretty big question mark. In addition to those side effects, there's some unanticipated feelings and side effects that people have had for those that are eligible for Trikafta. There can be a lot of fear and anxiety and guilt, changing their treatment regimen. So people have become so comfortable and so reliant on doing the same treatments every day. And this is what's going to ensure that they're going to stay healthy, and trying to get them to change that can be very anxiety provoking. Procedural anxiety, so having to do additional sticks for lab draws, for monitoring Trikafta that first year, can be very anxiety provoking, especially for the younger kids. The financial strain, additional lab work, there's been changes with the coverage for Trikafta, and that can be a lot of anxiety for people because they've been waiting for this miracle drug, and now there's concerns as to if their insurance is going to cover it and how much it's going to cost. Also, just the fear and disappointment or anger if your child or you have minimal response to the Trikafta. Everyone talks about the miracle drug and the huge changes that they see, but that's not the case for everybody. So the feelings that people have if that's not the response that either they or their child have. And then difficulty adjusting to diet and lifestyle changes and body image. So we've seen a lot of people in clinic that we've always push calories and bacon and butter, and now they're bordering on being overweight, and they're not used to this new body, and they're not used to being encouraged to have to exercise, and just having to deal with something that has never been present in their life. So the adjustments that come along with all of that. And I encourage anyone to share in the chat if you have any examples of unexpected side effects. If your child has started Trikafta, and maybe some feelings that have been associated with that. And then there are those who are not eligible for Trikafta. So some people aren't eligible for it, and some people are eligible for taking it, but can't take it because of liver issues or other concerns, and just feelings of being left behind and sad and worrying about your future and feeling angry. And feeling urgency for a medication that works for them, and just a range of emotions and opinions towards those who do benefit from Trikafta. And I think it's important to acknowledge all of those feelings and validate that, those are real feelings and that they're not wrong for feeling that way. So some of the support resources for patients, as I talked about, screening and clinic being available, individual counseling, medication management. So talking to your CF doctor, your pediatrician or primary care, or seeing a psychiatrist or someone else that can prescribe medication if talk therapy is not enough. The Cystic Fibrosis Research Institute has a benefit or a grant that can help pay for therapy sessions. They can do up to 6 sessions a year, $120 a visit. I know sometimes this grant runs out of money, so it's always worthwhile checking to see if there's availability with that. And then support groups. The CFRI also has support groups for adults with CF, teens, bereavement, post-transplant, and even for Spanish speaking. There's the CF Peer Connect. So if they are 16 and older, they could be matched with a CF peer. If they're 18 and older, they can actually be a mentor themselves. I do encourage you, if you have a child younger than 16, to reach out to your clinic. I think it's really helpful if your child's never met someone else with CF. I've connected families before, and kids have FaceTimed and done treatments together or played video games together and not even talked about their CF, but just to be able to know that there's someone else that goes through what you go through. So if they're younger than 16 and are interested in this, I would encourage you to talk to your social worker at your center to see if they could informally set you up and connect you with someone that would be willing to. Attain Health has a variety of virtual groups for adults and teens with CF. And then Make-A-Wish. This is something that I encourage families, when kids get to the age when they're in school and they're realizing that they're different than their peers, they have a lot more on their plate. They have to go to clinic and do the blood work, and they're having to do their treatments every day and take medication. And being able to bring up Make-A-Wish and something special that is unique to them and that they can do and that it's because, you have to go through this. And so here's a little benefit that you're eligible for. And I think it's worth mentioning too, many of you probably have heard that there is eligibility changing in 2024. Right now, CF is an automatic qualifier, whereas in 2024, there will have to be additional eligibility requirements. So for those that are of appropriate age, we've been encouraging people to move forward and take advantage of that while they can. So some helpful interventions, helping to try and normalize what your child's going through. If they're experiencing anxiety or depression, letting them know that there's nothing wrong with them or abnormal with them. This is a very normal thing that they're going through. Also validating their feelings, kids or individuals, this sucks, it's not fair. And instead of trying to argue with them, just validate their feelings. You know what? It does suck and it's not fair, but unfortunately, this is what we have to do to make sure that we keep you healthy. So just validating that those feelings are true that they have, and just trying to move on from that. So promoting coping skills. So helping their child identify ways that are positive for them to cope. So whether they're into journaling or drawing or music or exercise, whatever that might be for them. And if they haven't found a good coping skill, helping them to identify that and then encouraging them when they need to, like, hey, remember we tried that deep breathing and that really helped you calm down. Why don't you try that now? Or teaching them new coping skills that maybe would be helpful for them. Let's see. So problem solving difficulties that they're having with their self-care. So whatever area that might be, it might be in their airway clearance or their sleep or nutrition. So just trying to pinpoint what the barrier is that they're having and helping them to better attack that self-care issue. Building social support, address body image concerns, talk about their goals and aspirations for the future. So finding a therapist can be a daunting process. I always encourage people to definitely involve your child in this process. It's important to talk to your child and get them on board. If they're not interested, you're doing a lot of work for nothing. So getting them on board and also having them involved in the process. So figuring out what's important to them. Do they want to see somebody in person or virtual? Do they want to see a man or a woman? Do they want to be in a group setting or individual? Have them be involved in actually picking the therapist. I always try and make people realize that it's not a one size fits all. Just because maybe you have a negative experience with a therapist, that doesn't necessarily mean that there's anything wrong with the therapeutic process. It just wasn't a good fit. And I think people feel obligated to stay in a therapeutic relationship when they need to understand that it's okay to give it a couple tries. And if it's not a good fit, to move on to a better fit. I always tell people to give it at least a couple of sessions because it can be a little awkward in the beginning, just getting to know each other and getting into the groove. But after that, if you're feeling like they're just not getting you or you're not making any progress, I think it's time to look at finding someone that's a better fit for you. Making sure to talk to your pediatrician and or your CF center. They may have suggestions about therapists that are in your area. They may have a therapist on the team, and they also may have some financial resources to help offset the cost. Contacting your insurance just to make sure what coverage you have, how much coverage is available, and maybe even a list of providers that are in network for you. And then finding a provider. A lot of times we use psychologytoday.com. It's a really helpful tool to be able to filter. You can pick what you're looking for help with. You can filter it by man and woman and age and insurance and area. And then they have profiles with bios and headshots. And you can even look through those to help decipher, who you feel like would be a good fit for you. And then also your insurance webpage, if they send you who's in network with you, using that as a tool to identify who's accepting new patients and how long of a wait list they might have. So I think there's some helpful tools that questions you can ask before you even have your first visit. So What experience do they have working with children or adolescents or adults? If that's the case, do they have any experience with CF or chronic illness? What credentials that they have, what treatments they use, what's their appointment availability, what are their fees, what type of insurance do they accept? And I have a handout with all this information that I can share with Jennifer and she can send out to anyone, but just helping to guide, like interviewing that person to make sure that it's a good fit. And then some suggestions of questions to ask during your first visit. How will they coordinate their care with other providers? So are they going to be in communication with your CF clinic? What does successful therapy look like? How often will they be meeting? And what are the goals of the treatment? And what are their preferred methods of communication? So I think it's not vital that the person has specific experience working with someone with CF. If it's a really good fit for a therapist or they come highly recommended, the foundation does have this handout. And it goes over what is CF from like a biological standpoint and a psychosocial standpoint and the burden of CF care. And then this way, the patient isn't having to educate the therapist and wasting that time to get them caught up and filled in. So helping to educate them. And there's a possibility too that your social worker or someone else on your team is willing to talk to that therapist and kind of give them the down low on CF and how that can affect them mentally and emotionally and physically. So you may be wondering, especially if you have a teenager, what you can do if they're refusing to get help. And I see this all the time. So in clinic, we'll do a screening and they are scoring off the charts with the PHQ-9 and I want to refer them for counseling and they're just like, nope, not interested, not going to do it. So some of the suggestions that I have is definitely utilizing your CF social worker or mental health coordinator. If there's a relationship there or the possibility to build a relationship, maybe they'd be willing to do therapy with them. And even if not therapy, then, not calling it that, but doing check-ins with that person or having them talk about coping skills to try and just something that they can work on rather than being in full-blown therapy. Utilizing any resources possibly at school, sharing your own experience. So if you've ever struggled with anxiety or depression, you've ever been in counseling, just sharing what you've done. Getting them connected within the CF community. So like I talked about before, having like a peer mentor or someone to help sort of normalize what they're going through can really help. Trying therapy together or as a family. So maybe they're anxious about just trying it by themselves. And if you're like, okay, we'll go do this together. I'm not going to say bribe them, but try and make some kind of deal. I know that this is something you wanted to do or something you want. If you go and see this therapist and try it out a couple times, maybe we can go do this or you can get this. And just encouraging them to give it a try. If they've never tried it before and they just have a negative connotation, just encouraging them, oh, you don't have to commit to anything and do it forever. Just give it a couple sessions. If it's not helping at all, you don't have to go back. Open communication. So specifically, if you have concerns about their safety and maybe they don't really want to talk to you, something as simple as like, how is it going today? Thumbs up or thumbs down. And talking to them about how they're comfortable communicating about this and how much they want to talk about it and helping for you to understand if they don't want to talk to you, who are they talking to? And if they don't have someone to talk to, having that conversation of identifying who their safe person is, what adult that they can have to talk to, especially if they're ever having any concerns of self-harm. Being patient and not giving up. So teenagers are really tough, but the good news is that they're not teenagers forever. So as they get older and wiser, they may be more open. And the last thing you want to do is just have a traumatic therapy experience where they're never willing to go back or try it again. So just taking all of it with caution and at their pace and at their comfort level. So support for parents and caregivers. A lot of clinics offer screening for anxiety and depression or have self-screening tools offered. Self-care, I know it's such a lecture. We all know how to self-care. Nobody has enough time to do any of it. But if you find yourself struggling, really trying to focus on what you can do for your self-care, whether it's sleep or exercise, getting outside, asking others for help, setting good boundaries, just trying to do the best you can with your own self-care. There's the old adage, like, you can't help someone else if you're not in a good place yourself, or you can't pour from an empty bucket. That's why I have that airplane oxygen, because you have to put your own oxygen on before you can put your child or anyone else that you're a caretaker for. So taking care of yourself first. Doing therapy for yourself, utilizing, if you have a job that has EAP, the Employee Assistance Program, the CFRI benefit, that's for caregivers as well as for individuals with CF, Psychology Today, like I talked about, or talking to your primary care doctor. CF Peer Connect has opportunities for caregivers as well. CFRI has a caregiver support group, and Attain Health also has a peer support group for caregivers. So as we know, CF doesn't just affect the patient, it affects the whole family. And if there are siblings involved, they definitely are affected as well. A lot of siblings can feel guilty, they can feel anxious, jealous, angry, embarrassed, depending on the age of the child. There's some different tactics to utilize to help them understand or cope better. We always recommend getting siblings involved in treatments, so giving them a job and making them feel like they're involved and that they're helping in some way. Bringing them to an appointment, and definitely talking to your clinic staff, because maybe there's certain things that they can do, like bring in Child Life to help the child better understand the diagnosis. They can watch and see what their siblings actually experiencing at the visit. They might be jealous, like, oh, mom and dad take my brother or sister, and then they get to go to Chick-fil-A and they're having all this fun. But then they go and see that they're getting their blood drawn and they're doing these things that are not as fun as they're imagining it to be. And then just having open communication about their feelings and questions. So, being honest with them and providing what's developmentally appropriate for their age, information about the diagnosis and prognosis, and just giving them a space where they feel comfortable to be able to communicate what they're feeling and what questions that they may have. Because depending on their age, they may be going to school or different places, and they may be getting a lot of questions and they don't know how to answer those questions. So helping them to better understand, so that if they're asked questions by other people, that they feel comfortable and confident in how to answer that. Spending time with each child individually. I know that this can be tough. Nobody has enough time for everything, but if there's a special thing that you can designate with each child, and obviously taking your child with CF to the doctor is not their special thing. But picking something that you can do, whether it's something small or, something larger if you have more time. Having fun as a family. You may want to check in your area. There's an organization called A Kid Again, and they have opportunities for the whole family to be able to do experiences. Like here in Charlotte, they might go to Carowinds or to a checkers game. And so they provide those experiences to the whole family. So not just the patient, but the siblings and parents as well. Maintaining rules. A lot of times in families, it can be hard to maintain the rules, especially for your child that has a chronic illness. They're already going through so much, and you may feel like you're being mean or hard on them, but it's important to just have consistency and the same rules across the board for all of your children. And then your child may need therapy or a support group. They may enjoy being part of a support group of siblings of children that have chronic illnesses, to help feel like they're not alone. There's other people that can share their experience, or maybe just a therapist that they can talk to. So one of the last things, who are the helpers? Don't forget about child life specialists. If your child has a lot of anxiety heading into clinic, especially if they know that an annual review is coming up where they're going to have to do a lot of blood work, requesting to have child life involved to help make that a more positive experience. Your LCSWs, so that's like myself and Ellen, and may do counseling or just are doing the screening and interventions and referral. Your licensed professional counselors also can do therapy, and there are LCSWs or licensed clinical social workers outside of your CF clinic as well, and they can provide counseling. And I think that sometimes can be confusing. All of the disciplines, like people may think, oh, just a psychologist or a psychiatrist can do certain things, but your licensed clinical social workers, your licensed professional counselors, your school counselors, and your psychologists can all provide counseling. And then for medication management, typically looking for psychiatrists. And then I feel like mental health and talking about all this is a very heavy topic, but there is a lot of hope in the CF community. And over the last 8 years that I've been part of my CF center, I've just seen so much change, and I know that there's so much hope for the future. And although it is tough and there's a lot that individuals with CF have to deal with, and mental health is a heavy topic, and it's something that everyone is experiencing, especially coming out of COVID. So it's not unique to this population, but obviously there is a higher prevalence. But just wanting to instill and leave it on a high note of that there is hope and things will get better. And that, you know, I've already seen how far it's come, and I'm excited to see where things will go in the next several years. So if anyone has any questions for me, you can enter them into the chat, or I've included my email as well. If anyone has any specific questions that they would like to follow up with later.
I just stopped the screen share, but I would put, I'll put your email address in the chat for everybody.
Perfect, thank you.
And there's some questions appearing in the chat now. I don't know if can you see those?
Yes. So the Make-A-Wish thing is tough. Before they were talking about changing the eligibility criteria, I typically brought it up to families around age 10. I think it's hard, even though the eligibility is at 2.5, it's not specific to CF, that's to all diagnoses. So, you know, kids with cancer, like they're only eligible while they have cancer, and then when they recover, they're no longer eligible. So those individuals may take advantage of it at a much younger age. But I do find that my kids who have gotten Make-A-Wishes at young ages, they don't necessarily remember it. Maybe they regret what they picked and they want to do something different. So I think when they are mature enough at an age where they really know what their interests are, they can participate in the conversations about what they would like to do, and they're old enough where they're going to remember it, I think is a great age. But now I think taking into consideration, and that's with everyone's own decision to make, that maybe they're eligible this year and they're not going to be eligible next year. You may want to take advantage of it this year, or maybe you're not comfortable with that and you don't. So I think it's a personal decision. Oh yeah, I did. Sorry. Get so nervous. I forget to mention everything. So there's this book, and it's called The Wacky Juice Machine. So we had a resident that worked with us, and she actually has, it's a website called The Strength of My Scars. And she does books about all different medical conditions. And one of the things, she picks like an analogy to help explain that diagnosis. So the Wacky Juice Machine, it talks about CF, and basically the concept is that, you know, there's these thick, like a milkshake. It's, I don't know, you'll have to read it to be able to. But the great thing about it is that it's great for young siblings to help them understand, because as we all know, CF is such a difficult disease. It's so hard to explain. But I've found that parents and adults love it just as much, because they're like, oh, you know, I read it or I shared it with so-and-so and it really helped them to understand. So even though it's targeted at a child, it really makes it even for adults, like those who aren't experiencing it firsthand and coming to clinic and learning, sharing this book to be able to help them understand what CF is. So you can buy them off of her website. We have some in our clinic that we provide to families, but I know kids always get really excited whenever there's a book that has anything to do with CF, because you don't necessarily find it all the time. This one, and then you may have seen the Who I Am book. So this is something like for a younger crowd. Usually, like, I encourage kids when they're starting school, it's something they could take to school and share with show and tell to help like explain to the class about their CF, so that they're not having to explain it. And then the younger that kids are, that they can kind of tell their classmates about what CF is. And if they're staying at that same school and they grow up with these kids, then these kids, it's just normal. And that's what they know about this student. They're not bombarding them. Why are you taking those pills? Or why do you cough so much? They're like, oh, that's Susie and she has CF. And, you know, we know all about it. So I do encourage, if kids are comfortable, to disclose to their classmates or their close friends about their CF. And it can be helpful too. They can remind them, hey, don't forget to take your enzymes, or tell their parent like, hey, she, you know, was choking today or coughing a lot. And maybe the patient doesn't want to share that with their parents. So it is helpful to have at least a couple close friends that know about the patient's CF and what they're going through. Yes. So in terms of people that keep it a secret, you know, it's a personal choice. I don't know percentage wise. Obviously, the older kids get, the more closed off they are. They can be more self-conscious of wanting to share that. I think that's easier if you stay in the same community and you've known the people since you were a child. Everybody knows and it's no big deal. But if you go to a new school, or you know, when you go to middle school or high school, I've had a patient that got up at an assembly and had a fundraiser and had a shirt on and told everyone about her CF. But that's not common. That's not everybody. And I think it's totally fine that people don't want to be open and out about their CF. They don't want people to categorize them a certain way or characteristic of it. And that's totally fine. But what I do encourage is that at least one close friend, that they are open with them, and that's someone that they can share with and confide in. So I think there's no concern if they're not open and telling everybody about it, or like I say, like wearing a shirt that says I have CF. But as long as they have one friend that knows what they're going through and they feel comfortable sharing with. Where I get concerned is if they don't tell absolutely anyone and they don't want to share that or have anybody know, then I feel like working through that can be helpful, so that they can at least have one friend that they share that with. Yeah, having a foster child that's hospitalized. Definitely that first hospitalization can be really tough, and some people never experience it. And just the adjustment of, like you said, they're fine for a year and a half, and then it's unexpected, and having to adjust with missing work or them missing school can be a stressor on them and the whole family. So I definitely feel for where you're coming from. And I hope that you guys will reach out to your social worker, if not already, about what kind of support and resources you guys can get to deal with and go through that experience.
Any other thoughts or comments or questions, or anyone want to share any of their personal stories or experiences? Go ahead. I think you can unmute yourself, I think.
Figured it out.
Yeah.
I just wanted to make mention on Trikafta bit. You know, with my daughter, she's 7, and we tried Trikafta. So excited about it. It's a big ordeal. It was kind of like a rug getting ripped out from under you when, you know, she developed a lot of mental health issues that she'd never had before, and accompanied with some GI issues as well. And I know you had spoken on this earlier, but, you know, one of the things that her and our clinic have discussed is, you know, whether she'll be able to get back on it or not. And they do feel confident that she will. And like you were saying earlier, maybe at like a smaller dose, but there is this huge hesitancy to visit that again because the experience was so extreme, especially for being 7, and it just was a complete it was almost like that was not our child, right? And so I'm curious if I know you had touched base on this, but I'm curious if you've seen situations like that where they do, instead of taking it years down the line, if they do revisit it, let's say a year later or a few months later at a smaller dose, and if there has been like if there has been some type of resolve in the mental health aspect of it.
Yes. So first of all, I'm sorry. I know that had to be very traumatic, just, witnessing your child go through that. And then also the expectations you have for Trikafta. And like you said, having that ripped out from underneath you is very disappointing. I can think of a specific example. I can't remember how old he was. He was definitely older than 7, but maybe closer to like 10 or 11. And had to stop it because of the extreme mental health side effects that he was experiencing. And we have been able to start it again with success. I think that the age has to do a lot with it. At 7, things are really difficult. There's not as much insight at that age, and ability for coping skills and things. So if tried when she's older, and not saying you have to wait until she's a teenager, but the older that she gets, the easier it is to intervene and cope with and deal with some of those side effects she's having. But also they are doing studies. The study that I saw was very small. It was a very small subset, but they were showing that a reduced dose of Trikafta had similar clinical benefits in terms of like their PFT and a reduction in those mental health side effects. So I think there's definitely hope and encouragement for that. And I think talking to your team and figuring out when the appropriate timing is to maybe trial a smaller dose, and maybe like getting her engaged with a therapist right off the bat to kind of monitor and deal with anything that may pop up. Because I'm sure for all of you, it was very traumatic, and all of you are probably hesitant to retry this just because it was such a scary experience. So finding the right time to try that again will be important because of the trauma that all of you experienced.
Thank you. I'm just trying to find out if there's a time that the benefit would outweigh the risk, as her clinic says all the time.
Yeah,
that's
very
insightful,
yeah.
and encouraging to hear.
Yeah, it's very individualized. And I think too, if she's eligible for other modulators, and these are more appropriate conversations with your pulmonologist, not necessarily your local social worker, but weighing those risks and benefits, but knowing too that they are doing studies and trying to figure out for those where the mental health concerns persist, what that looks like for a reduced dose and the long-term effects of it.
Are you familiar with any of those studies offhand by chance?
I can email it to Jennifer. I have it saved, but I don't remember what it was called or anything like that. So,
to see.
yeah, I can send it to Jennifer and she can share it. Like I said, it was a small study, but it was pretty encouraging in terms of the efficacy.
Yeah. Thank you.
Yeah.
Ma'am. Hello?
Oh, yes. Sorry.
No. I had a question just on that because I've got a child that's on Trikafta and another one that's on Sindecco. And I'm just wondering, like, the children that experience that, is it a deal where they do the whole package automatically, or there's not enough information on that? Because I know that the child that's on Trikafta, she's been on it for a year. Of course, not everybody's going to be affected the same, but they've gone from like just taking one pill at a time to barely this year telling us, okay, she's going to start taking both of them, but not the blue pill.
Yeah, I think that's something to, talk with your pulmonologist and pharmacist if you have one, to kind of figure out what that looks like. We have adjusted dosing too for patients that have liver disease. And so monitoring with labs.
Correct.
how that affects their liver. So I think that similarly with your mental health, you'd have to trial and error, giving certain doses and seeing how it affects them and going from there, because there's just not the research out there yet as to exactly what
But
that looks like,
yeah,
and it affects everyone differently.
correct. And like you said, it was a small study. I was just wondering if they, in that study, they talked
Oh.
about how much medication they were giving the patient.
I don't remember specifically. I think it just talked about a reduced dose. So I think
Okay.
it would all depend on their age and their size, what that would look like. But yeah, most likely, like you said, maybe reducing one pill out of it. So
And I think the next question is I think it's maybe towards us because we have adult children, I think. Is that correct? I don't know who iPhone is, but hello, iPhone. So I don't think our daughters had ever come to talk to us about that. Although I think it has been mentioned in a few of our other meetings that we have had with different social workers and mental health people, like just, that does come up because you do see statistics about, longevity and I think what Beth, you had said about the end, I mean, when we first had our kids, I think the average age was 38 or it was pretty low. It was lower than that, I think. But then every year it seems like at least it goes up 1 year or two. So now it's up to, I don't know what it is now, 52?
I'm not sure.
Something like that. So it's like doubled. I don't know. Sorry, I don't know the statistic. But anyway, it's gotten much better. And it's really a result of all the stuff that the CF Foundation has done and all these different medicines that are out there and all the different treatments and just, just overall. So as far as handling it when they ask to come.
Oh no, mine, one of them asked it when she
one
was
did.
5.
Okay.
Oh no, she asked.
Jen's got a better memory for this stuff.
Well, she asked me.
Okay, there you go.
So I remember. But no, I did. I ended up calling. Well, I answered her questions like Beth was saying, like developmentally appropriate. I kind of asked her to tell me a little bit more, and so to try to get we just kind of chatted about it. But I did tell her, we don't know exactly. Michelle just put in the chat, it's 53.
Okay, thanks, Michelle.
But anyway, I ended up having a conversation with her and just asking her, just at her age, asking her to ask me questions, and we kind of talked about it. And then it did come up later, but I mean, by that time, I think there were books that the clinic put out. I can't remember the company, and it's been a while, and maybe they're not even still there, but there are a bunch of books about CF that they had from the clinic. So we read through those together.
Mm-hmm.
So I don't know if you have any other ideas, Beth, but that's what.
And wasn't there some humorous story about some kid who asked some parent, and then what they were really trying to get to was something totally unrelated? So trying to make sure that the kid is like really understanding what your child is asking, because it might be something very benign and something very different than like immediately thinking, oh geez, they're scared about dying. It might be something completely different.
Right. Do you have anything to add to that, Beth or Ellen or anyone?
Yeah, I think you handled that correctly. And we always say, like, what's developmentally appropriate? Obviously you don't want to talk to them like they're a 20-year-old, but being open and honest. And the scary thing is Google now, and you want to make sure that you're having conversations with your kids before they're hearing it from someone else, or they can Google it themselves. So, I mean, we've had terrible stories about male patients finding out that they're infertile from the internet or from a classmate who Googled it, and not from their clinic or from their parents. So, life expectancy obviously is a terrible conversation to have, but I think the biggest thing is looking at how far we've come. And so the future is so unknown and there is so much hope, but being also realistic about, well, this is what the science says, but that we have no guarantees about anything in the future, and there's so much progress and hope. So we don't really abide by that or adhere to that or believe that kind of thing. So. But Ellen, what about you?
No, if you don't, I just have this is actually a conversation that has come up very recently this past week in our clinic with a young man. And one of the things that was actually the most helpful, again, just like both Jennifer and Beth said, sort of meeting him where he was at and really figuring out what was he asking. But then he was able to have a pretty frank conversation with his physician without parents in the room. just so that he and the physician could kind of talk. And she was able to provide him with just data, like information that, as Timothy was talking about, how things have really progressed and how things have changed. And I think he heard some of it. He's sort of a young guy, but just sort of those facts were really helpful in that case. So just something that came up recently.
I just wanted to say one thing on kind of piggybacking off of both of those things. My daughter, who's 7, she's pretty intellectually ahead of herself. So she's very, philosophical and asking all these big questions. And Jennifer, just like your daughter, she did ask a question similar to that. And she's a very, black and white mindset. And she just wants to know. And I don't think she heard it from anywhere. Maybe it was just, I know there was like a scenario where, there was a conversation she may have overheard about, oh, I knew someone who had that and she had 4 kids and so many of them passed, etc. So I think maybe that's where it came from. But when we spoke about it, I kind of used it as leverage to, help her get excited about advocating. And we do like Layla's lemonade stand and things like this to raise funds. So the conversation we had was, a long time ago, their medicine wasn't as advanced as it is now. And taking it in a perspective of, we're in a time when medicine is booming and they have, come up with so many more medications. I use an example because she's young, that before they didn't have enzymes. And so kiddos weren't able to digest their food properly and absorb those nutrients. And now we can because of all this research. And so, as time goes on, people are living longer lives. And right now, people are still living to be much older than they used to be. And who knows, again, as a kid, who knows when they get much older, people might live past the age of 100. And that's why it's so important for us to keep advocating and, fundraising. And it gets her excited to talk about her CF with people and to be open about it and to come up with ideas for fundraising and things. And I personally felt that was appropriate because it kind of sets the stage for her. And I know the teenage years are not far away and that's going to be a different bumpy road, but I think I'm hopeful that it'll kind of help her to take CF more in light. I know sometimes it's not always easy. There's ups and downs, of course, but I don't know, the conversation we had when she had asked that question about, Mama, is it true that people with CF can die? I might pass away early. And of course, nobody knows with or without CF, everyone has their hard, etc. But I feel like I found that was helpful for her to kind of make sense of it and to be more like proactive and staying positive about everything. I'm sorry for the ramble, but I thought that could be helpful for someone if their child does come to them. It helped Layla anyway.
That's great. Thank you. A few people have had to leave. I just want to thank Beth so much for the presentation. There may be a few other questions, but I also want to put those last polling questions up. If you don't mind, there are a few questions. And then, yeah, maybe, but thank you so much, Beth, for your sharing your expertise, and your slides were great. I really, really appreciate it.
Yeah, it's a really important topic.
Yeah, thank you for having me, for sure.